If you watched our BPC-157 or TB4 videos, you probably got annoyed at just how frequently I said that BPC-157 is not currently FDA approved for human use. Well, you're in luck because today we're covering a peptide that excitingly just got FDA approval, and it's SS-31. And this mitochondrial peptide also has some super promising off-label uses as well, including for dementia, chronic fatigue, or even just general anti-aging and longevity. So today we're covering the mechanisms behind SS-31, the recent FDA approval, and its other studied benefits. And then we're jumping into the how-tos. We're talking about the optimal form, dose, timing, and cycles of SS-31. Let's jump in. So there are two main types of mitochondrial peptides. One are mitochondrial-derived peptides, meaning they are naturally produced from human mitochondrial DNA. Think MOTS-c or humanin. Then the second group I like to call mitochondrial-targeted peptides. These are synthetic peptides, meaning they are not naturally produced by our mitochondria, but they were specifically created to target parts of the mitochondria to help improve their function. This group includes SS-31, known by its drug name Elamipretide. SS-31 is a very small peptide. Specifically, it's a tetrapeptide, or a peptide consisting only of 4 amino acids. And this small size, along with other parts of its structure, including the fact that it has a positive charge, allow it to penetrate through many different membranes, making it all the way to the inner mitochondrial membrane where it has its action. But to understand how SS-31 does its work in the mitochondria, you first have to understand how the mitochondria work in general. So embedded in that inner mitochondrial membrane is something called the electron transport chain, which is essentially just multiple protein complexes that pass electrons down along the chain with the end goal of creating ATP, essentially an energy currency for the cell. However, this electron transport chain doesn't function perfectly, and sometimes electrons leak out and create something called reactive oxygen species, or ROS. And these ROS cause damage to the mitochondria and the rest of the cell. Specifically, in the inner mitochondrial membrane, the ROS damage not only those protein complexes that make up the electron transport chain, but they also damage a very important molecule known as cardiolipin. And cardiolipin is a negatively charged phospholipid that keeps the inner mitochondrial membrane and the protein complexes stable. So you can imagine that as cardiolipin gets damaged by these ROS, the electron transport chain becomes less stable. And this instability then produces more reactive oxygen species, which then leads to even more dysfunction of the electron transport chain, and then more ROS creation, and then this vicious cycle just keeps going on and on. And this snowball effect of mitochondrial dysfunction is actually one of the root causes of aging. And furthermore, this mitochondrial dysfunction is also at the root of many chronic diseases, including neurodegenerative diseases, heart failure, kidney disease, and the list goes on and on. So you can imagine the importance of finding therapies to inhibit this mitochondrial dysfunction, both to fight chronic disease and to hopefully prolong the human lifespan. And this is exactly where SS-31 comes in. Like we said, SS-31 accumulates in the inner mitochondrial membrane, and its function is to bind the ever-important negatively charged cardiolipin. And it's able to do this due to its structure and positive charge. And by binding cardiolipin, SS-31 is essentially stabilizing it and preventing it from being damaged by these reactive oxygen species. Which then, a more stable cardiolipin means a more stable inner mitochondrial membrane, a more stable electron transport chain, which means better ATP production and less reactive oxygen species. So basically, SS-31 is helping to put a stop to that vicious cycle of mitochondrial dysfunction, which would otherwise lead to decreased energy production, oxidative stress, inflammation, and eventual cell death. And because this mitochondrial dysfunction is at the root of many diseases and the aging process in general, SS-31 has been studied in multiple conditions. But the first condition to talk about that SS-31 has been used in is the one that actually got SS-31 or Elamipretide its FDA approval, and that is Barth Syndrome. And Barth syndrome is an ultra-rare genetic condition that causes alteration in the structure and the amount of cardiolipin. And only a few hundred people have this condition worldwide. And this lack of proper cardiolipin obviously causes mitochondrial dysfunction, which is especially problematic for muscle function due to the lack of energy production and the increased oxidative stress. This causes skeletal muscle weakness, along with heart muscle weakness, which unfortunately eventually leads to an early death in Barth syndrome. So it makes sense how SS-31 could be so beneficial for people with Barth syndrome, because it will stabilize their dysfunctional cardiolipin and then significantly improve their mitochondrial function. And this was seen in human trials on SS-31 in Barth syndrome, with those receiving SS-31 for 168 weeks having 30 to 40% improvement in muscle strength and other functional markers, and almost a 50% increase in certain heart function markers. And due to this impressive data and mechanism, SS-31 recently just got FDA approval for its use in Barth syndrome. However, this is the only FDA-approved use case for SS-31 currently. So all the other use cases that we're about to talk about for SS-31 are technically off-label, and as always, I would definitely be exploring them only in conjunction with your doctor. But what are the promising off-label use cases for SS-31? Well, to answer this question, it all goes back to the mechanism of SS-31. Basically, we ask ourselves, in what conditions are we going to get the most benefit from stabilizing that inner mitochondrial membrane and thus decreasing oxidative stress, improving energy production, and essentially just improving mitochondrial function in general? And like we've mentioned, many chronic diseases and conditions, including the aging process itself, are underpinned by mitochondrial dysfunction. So to me, the use cases for SS-31 could be many. But let's walk through the most promising potential use cases here. The first, which has a lot of great preclinical evidence behind it, is using SS-31 to prevent cognitive decline and dementia progression. Mitochondrial dysfunction is especially at the root of Alzheimer's dementia and heavily contributes to cognitive decline in general. And because of this, SS-31 has been found in multiple studies in mouse models to have some success in the treatment of Alzheimer's dementia, with studies noting benefits in learning and memory markers when SS-31 was given to mice with Alzheimer's. And there are additional studies on aging mice in general and giving these mice SS-31 to see how it affects their cognition. And yet again, it was found to improve their markers of memory and learning. So while we don't have any human studies on this use case yet, to me, this is a super promising use case for SS-31. The next potential use case also deals with mitochondrial function in the brain, and that is recovering from traumatic brain injuries, or TBIs. After a TBI, the mitochondria in brain cells don't function as optimally, and this further drives oxidative stress. So this decreased energy production and increased oxidative stress further drive brain damage and also cause delayed recovery. So by inhibiting mitochondrial dysfunction, SS-31 has been found to inhibit this further brain damage after a TBI in mice. And in this use case, SS-31 was also shown to decrease functional neurologic impairment after the brain bleed. So again, while we don't have human data in this use case yet, the mechanisms and this preclinical evidence get me really excited about using SS-31 in this use case. Next, outside the brain now, there's also some exciting data on using SS-31 in chronic kidney disease, or CKD. Kidney disease progresses largely due to continued oxidative stress. So by using SS-31 to improve mitochondrial function and decrease those reactive oxygen species, it makes sense that the SS-31 would lower oxidative stress, obviously, and then improve kidney function. For this reason, there have been multiple studies on SS-31 in different mouse models of kidney disease, including mice with diabetic-induced kidney disease, mice that have kidney disease just due to aging, and mice that have kidney disease driven partially by obesity. And in all of these cases, SS-31 was successful in improving kidney function. And while we don't have any human trials on SS-31 being used in chronic kidney disease, we do have one small phase 2 human clinical trial on patients undergoing stenting of the blood vessels leading to the kidneys. And in these patients, SS-31 plus stenting was found to significantly improve kidney function and blood flow to the kidneys compared to just stenting alone. The next potential use case is in diabetes and insulin resistance. Impaired mitochondrial energy production and increased oxidative stress downstream result in impaired glucose uptake into the cell, which eventually results in insulin resistance and then eventually diabetes. So through SS-31's ability to improve mitochondrial function, it could potentially play a role in helping reverse insulin resistance or even help mitigate the risk of complications from diabetes. And while we don't have any human studies on this yet, studies in mice have found that SS-31 has the ability to improve mitochondrial function in this diabetic state. The next use case to talk about is using SS-31 in chronic fatigue or related syndromes like long COVID or post-viral syndrome. And this one probably intuitively makes sense. SS-31 improves mitochondrial function, which improves ATP production, and you might also then sense a subjective energy improvement through this increased ATP. And on top of this, many studies note that chronic fatigue syndrome, long COVID, and these post-viral syndromes are definitely underpinned by mitochondrial dysfunction. Unfortunately, we don't have any direct studies on SS-31 in these use cases, but anecdotally, patients have noted improvement with using SS-31 for chronic fatigue syndrome or long COVID, etc. And we obviously do have human studies noting that SS-31 improves human ATP production. So in my opinion, studies definitely need to be done in these use cases on SS-31 because I think it's super promising here. But what about using SS-31 less for a disease or specific disease prevention and more just for anti-aging or longevity in general? Well, as we mentioned, mitochondrial dysfunction is one of the 12 root causes of aging. So it would make sense that SS-31 could inhibit the aging process by decreasing this mitochondrial dysfunction. And specifically, cardiolipin, the molecule, again, that SS-31 works to stabilize, decreases with age. So SS-31 could help to functionally prevent this decrease of cardiolipin with age and thus help to inhibit aging in this way. And we have some pretty exciting preclinical studies that start to provide some evidence for this ability of SS-31 to work on anti-aging. Specifically, we have multiple studies in mice where SS-31 was administered to see how it could improve functional markers of aging, such as exercise capacity and muscle and heart function. And in these studies, the mice were always found to have improved mitochondrial function, which led to improved muscle function and improved exercise capacity. And they were also found to have decreased markers of frailty and improved heart function as well. Now, unfortunately, unlike some other anti-aging peptides, we don't have any data from high-powered studies looking at SS-31 for lifespan extension purposes directly. But given its mechanism and this data that we have on functional markers of aging, I do still think there is some potential promise for SS-31 as a lifespan extender. But what I could definitely say is I think that SS-31 shows a ton of promise as a health span extender, or essentially improving the quality of the years we do have left. So to me, those are the main potential off-label use cases for SS-31, all the way from disease treatment to disease prevention, all the way to anti-aging and longevity itself. However, again, because mitochondrial dysfunction is so common and so problematic, there are definitely even more potential use cases for SS-31 that we didn't even mention here, such as using it in eye diseases, certain heart diseases, fibromyalgia, or other genetic mitochondrial disorders, and the list goes on and on. But before you can decide if you should take SS-31 for any of these use cases, we have to talk about the safety profile of SS-31 to really have a good risk-benefit analysis. Well, as you may have guessed by the fact that this one is FDA approved, we have a lot more extensive human safety data here. First off, we have that extended trial on the 10 patients with Barth Syndrome, where they received 40 milligrams of sub-Q SS-31 every day for 168 weeks, and no significant adverse effects were reported, only local injection site reactions such as pain, redness, and swelling. And then we have multiple other long-term human trials in which SS-31 has also been demonstrated to be safe. One trial in 218 participants with a different genetic mitochondrial disorder were also given 40 milligrams sub-Q of SS-31 every day for 24 weeks, and again, no significant adverse effects were reported, just the local injection site reactions. And then another trial of 176 patients with age-related macular degeneration. Half of these patients were given SS-31 at 40 milligrams sub-Q per day for 48 weeks, and again, just the injection site reactions. And then in a study on 71 patients with heart failure, half of them were given either 4 or 40 milligrams sub-Q of SS-31 every day for only 28 days this time, but still, again, no significant adverse effects reported. And no other human or animal study on SS-31 has ever reported a significant adverse effect that I'm aware of. And on top of this, mechanistically, SS-31 also appears to have a great safety profile. After all, its main mechanism is just selectively binding cardiolipin and stabilizing that inner mitochondrial membrane. There's no signaling or growth pathways involved like there are with other peptides in which you might be concerned about cancer promotion or immune system dysregulation. And then unlike other mitochondrial peptides even, where there might be a theoretical concern of overstressing the mitochondria by continually activating them, you don't have that concern here with SS-31, as again, we're just binding cardiolipin and stabilizing that inner mitochondrial membrane, not really activating the mitochondria. So while we don't have safety data on every off-label use case we just mentioned, all signs point to SS-31 being safe in those use cases as well. Again, due to that mechanism and due to all that human safety data we do have. But of course, you are always taking SS-31 in conjunction with your doctor's advice and with regular lab monitoring. But now that we've covered how SS-31 works and its potential benefits and its potential risks, although there are few, let's talk about who should actually consider taking it for disease prevention, disease treatment, extra energy, or anti-aging. Well, due to the low risk profile on this one, I'm much more likely to recommend trialing it for any of the use cases that we've mentioned. But in regards to disease treatment and prevention, personally, due to all the data and mechanisms, I'm most excited about using this one for neurodegenerative diseases such as dementia and cognitive decline, as well as in traumatic brain injuries. And then a close second I'm really excited about using this one is in chronic kidney disease. For all these top use cases, I view SS-31 as a top tier peptide. And I also see a role for SS-31 in insulin resistance and diabetes, but I do think we have more powerful and more cost efficacious options for these use cases, so I'd try those before SS-31 here. Then I also love the idea of using SS-31 in, again, chronic fatigue syndrome, long COVID, etc. But we don't even really have good preclinical data here, so it's really more speculative based on the mechanism. So if you are someone looking to use SS-31 for an energy boost, I would really be looking at your labs to look for signs of mitochondrial dysfunction. Because if your labs point to the fact that your mitochondria are operating at a deficit, then SS-31 is likely going to be a great option for you to improve energy. And then for other use cases, I'm less of a fan of using SS-31 for heart failure because the human study we talked about earlier didn't really show much of an effect of SS-31 in heart failure. And I'm also less of a fan of using it for macular degeneration, as again, that study that we mentioned in the safety section didn't show huge effects for macular degeneration. So I don't think SS-31 is a great cost-effective option here. But what about for anti-aging? Well, I think this one can be a great addition to an anti-aging stack, but only once your mitochondria become dysfunctional. This typically occurs with age, and this decline has definitely been studied in multiple human trials. And in mechanistic mouse studies, they note that this significant dysfunction started to occur at the mice age of 18 months, which is an equivalent to about a human age of 50-ish years. So I'd say adding in SS-31 could make sense in an anti-aging stack in your 50s or earlier if you measure those mitochondrial labs we mentioned and they're dysfunctional. Adding SS-31 in earlier than this is likely not going to give you much benefit when it comes to anti-aging. And this was seen in all of those mouse anti-aging studies that we looked at earlier. When the young mice in those studies at a human equivalent age of 20 to 30 years old were given SS-31, they just didn't have any positive effects seen. So I'd stick with taking SS-31 for anti-aging purposes in your 50s and later. But if you are going to take SS-31 for anti-aging or brain or kidney protection or even chronic fatigue, how should you do it? Let's talk about the optimal form, dose, timing, and cycles of this peptide. Well, for form, we have human studies on intravenous infusions. And then we also have human studies on subcutaneous injection. And that's the more common form in what was used in all of those long-term human trials we mentioned. Notably though, what we don't have is any human study using oral SS-31. And even in animal models, only injectable forms have been used. To my knowledge, there's never even been an animal study using oral SS-31. So based on this lack of data, I don't have a ton of confidence in oral SS-31. That being said, the fact that SS-31 is only 4 amino acids long does help its case for having some oral bioavailability, as smaller peptides are generally better absorbed and less likely to be degraded by enzymes. However, interestingly, peptides that are only 2 or 3 amino acids long have a much higher bioavailability than do peptides that are 4 amino acids long. Reason for this is there are specific transporters in the intestine that transport in peptides that are 2 or 3 amino acids long, but they won't transport in those that are 4 amino acids long, such as SS-31. So unlike its even smaller peptide counterparts, the 4 amino acid chain of SS-31 is less likely to be absorbed and more likely to be degraded. So in my opinion, we would need a pretty dang good advanced formulation of SS-31 to improve its oral bioavailability. And while I do think this is becoming possible, we just don't yet have any data, obviously, on these oral formulations of SS-31. So for me right now, I'm sticking with the sub-Q form of SS-31, as it's obviously more available and practical than the IV route. But what is the optimal dose sub-Q? Well, interestingly, in almost all the human studies using sub-Q SS-31, the dose was 40 milligrams per day. And as we discussed, I feel fairly confident in the safety of SS-31, even at this dose, due to the mechanisms and all the long-term human safety data we have. It seems like the dose of SS-31 should be 40 milligrams per day, right? Well, I think there's two important considerations for us to talk about when actually determining what dose of SS-31 you should take. The first are the populations that SS-31 was actually studied in these human trials. Outside of the study on macular degeneration, all of the human trials have been in patients with very, very significant mitochondrial dysfunction. One was in heart failure, and then the other ones are in genetic forms of extreme mitochondrial dysfunction. Specifically, most of the studies were in Barth Syndrome, probably the most dysfunctional mitochondria you could get. And then a lot of the other studies were in primary mitochondrial myopathies, another genetic condition with very significant mitochondrial dysfunction. So logically, if you are not in these groups and your mitochondria are genetically normal, then it would stand to reason that you might need less SS-31 to still get positive effects for mitochondria that are more so just slightly dysfunctional due to aging. That being said, based on the mechanisms, it will likely not hurt you to take the same 40 milligram dose that these populations were taking. But the point is that you might be able to get away with taking less and still see a positive effect. And that is important for the second consideration regarding the dose, and that is the cost. This can be a pretty pricey peptide, with the cost from compounding pharmacies being about $1 per milligram when bought in higher quantities. So if you were doing that 40 milligram per day dose, that's $40 per day, which is not too sustainable for most people. So the question then becomes, for the use cases we talked about in genetically normal mitochondria, how much do we need per day to actually see a positive effect and still be cost efficacious? Well, in most of the anti-aging studies in mice, they used a 3 mg per kg sub-Q dose per day. So with standard human equivalent dose calculations for a 70 kilogram average sized adult, this would be about 17 milligrams per day. And while higher doses, generally 5 mg per kg per day, were generally used in the brain use cases we talked about, that 3 mg per day dose was also used in most of the chronic kidney disease studies in mice as well. And there was even one mouse study in kidney disease that used a 1 mg per kg intraperitoneal dose, which for a human equivalent dose for sub-Q would translate to 0.09 mg per kg, or for a 70 kilogram adult, only 6 milligrams per day. And then in one of the anti-aging studies, they used 3 mg per kg intraperitoneal, but only applied it 2 times per week. So that's a sub-Q human equivalent dose of, for an average sized adult, 18.5 mgs per injection, but since it's only 2 times per week, that averages out to just over 5 milligrams per day. So based on all of this and taking cost into account, for the use cases that we described, I like starting with about 5 to 10 milligrams per day of sub-Q SS-31, and then seeing if we get an effect. And this is obviously done in conjunction with your doctor because it's important to see if we're getting an effect subjectively with your symptoms, but also if we're getting an effect on labs as well. And if you are noticing a positive effect at 5 to 10 milligrams, then of course stay there. But if not, then you can begin working up in dose if that's available to you based on cost, as there definitely does seem to be a dose-dependent response in the studies. And how much you need is super dependent on your specific circumstance and how dysfunctional your mitochondria are and what use case you're using it for. So that's why doing this in conjunction with your doc is super important. But in general, I like starting at 5 to 10 milligrams per day and working up in 5 milligram increments until we see an effect with a max dose of 40 milligrams per day. But how frequently should you inject SS-31? Well, you might have noticed from our discussion so far that almost all the human studies and almost all of the animal studies are using 1 time per day dosing. And the reason for this daily dosing is that SS-31 is rapidly metabolized and taken up into tissue, with studies noting that within 24 hours, all of it is out of the plasma. And again, based on its mechanism, you need continued exposure to have an effect. This is again because it's less of a signaling molecule that triggers a downstream pathway and more of a structural support within the mitochondria. So after it's metabolized out, its effect is going to more so wane because it's no longer there to provide the structural support. Hence the most common everyday dosing to provide continuous tissue exposure and continual mitochondrial support. However, that being said, SS-31 does accumulate in the mitochondria, so its presence and effect could last longer than its presence in the plasma. Furthermore, there's also something to be said about using SS-31 to stop the vicious cycle of mitochondrial dysfunction. And by helping stop that snowball effect, you're in a sense somewhat providing a reset to the mitochondria, which could potentially have longer lasting effects even after SS-31 is completely metabolized out. So maybe you could get some potential benefit from less frequent dosing. And in addition to this, there are a couple of studies in animals that use less frequent dosing and still had a positive effect. one being in one of the anti-aging studies that we just talked about, and 2 being in an Alzheimer's study. But overall, based on all of the plethora of data at once daily dosing and based on its mechanism, I still think it's ideal to do once per day dosing at 5 to 10 milligrams per day to start. And I would prefer this to an equivalent weekly dosage split only 2 times per week, i.e. I'd prefer a 5 milligram everyday dose compared to a 17.5 milligram dose 2 times per week. But if cost is an issue and you wanted to attempt it here, you might still see a potential benefit at doses of 10 milligrams plus only 2 times per week. But how long should you cycle on SS-31? Well, as we talked about in the human studies, they used SS-31 continuously for durations that are pretty long, 168 weeks every day in the Barth Syndrome trial, or 48 weeks every single day in the macular degeneration trial, or 24 weeks every single day in other trials. And the reason they were able to do this is SS-31's favorable safety profile that we talked about, and also due to the fact that there's much less concern for SS-31 having any tachyphylaxis or tolerance. Tachyphylaxis or tolerance are generally caused by receptor downregulation or receptor desensitization or other changes in signaling pathways caused by repetitive exposure. But again, because SS-31's mechanism is just to bind cardiolipin, there are no receptors involved, no signaling pathways, so tolerance is much less of a concern, and that's part of the reason why they were able to give SS-31 continuously. So really, the only reasons to cycle on and off this one are 1, to mitigate any unknown safety concerns, which, like I've said, are less for this peptide compared to others, and 2, for cost reasons. And for these reasons, if using it for anti-aging purposes, I generally like a 1 month on, 1 month off cycle as a starting point. And this also gives your skin time to recover because injection site reactions are still somewhat common. But in reality, the cycles on this one are extremely individual specific. Again, depending on your specific use case and your level of mitochondrial dysfunction, you might be on this one for a very short term, or you might be on this one very long term continuously. All are likely safe, but again, everything here should be done in conjunction with your doc and regular lab work. This way you can also get the SS-31 from a compounding pharmacy that's highly regulated instead of getting it online through a research use only site, which has no regulation and opens you up to additional safety concerns. Hit that subscribe button to see our next video coming soon on additional mitochondrial peptides, MOTS-c and CB4211. And in the meantime, check out this playlist to watch more on peptides.